What is bicuspid aortic valve? Bicuspid aortic valve is a congenital condition in which the patient is born with two aortic valve leaflets as opposed to one. With this deformity, the valve does not function as normal due to the structural differences, but it may function adequately for years without causing symptoms. As you can see right here, this is a normal valve with three leaflets. In patients born with this disease, as you can see here, they only have two leaflets. Causes of bicuspid aortic valve. The cause of bicuspid aortic valve is still unknown, but studies do show that about 2% of the population has this defect, and it is twice as common in males as it is in females. Signs and symptoms. Aortic stenosis. Aortic stenosis is typically seen in elderly patients, and if noticed in somebody younger, for example 40 years old, that would be a huge indicator of this defect. The heart is also likely to thicken due to the increased pressures that is required to pump out the blood through the valve. Common symptoms are chest pain, shortness of breath, dizziness, or fainting caused by the lack of blood flow to the brain. The chamber may also dilate if the valve does not close completely, causing aortic regurgitation. A serious complication of bicuspid aortic valve can be heart failure due to the enlarged ventricle and insufficient pumping. The treatment for BAVD. About 80% of people with bicuspid aortic valve will require surgical treatment to repair or replace the valve and part of the aorta. This procedure is usually done in the 30s or 40s. Patients seen with aortic stenosis will be urged more likely to get this replacement.